Hi, a very good morning to all of you. Today we are going to discuss the case now of Miss Bethany Taylor, the daughter of Henry Taylor and Mrs. Barbara Taylor, who has been diagnosed with schizophrenia, which is relapsing. Now, who you are a psychiatric nurse working in a psychiatric ward, treating Miss Bethany Taylor, a 35-year-old unemployed lady. Now, right now you are going to write a letter to the receiving nurse at the long-term care home where the patient will go following discharge. So the patient needs long-term care because this is what we call decompensated schizophrenia. So the chances of recurring the symptoms are comparatively higher. So you need long-term care for this patient. And she's going to be getting discharged today. And you're going to write to Maria D. Koshia, Powdhurst Mental Health Home, 231 Brightfield Avenue, Powdhurst. So you are going to outline the details of this patient, Miss Bethany Taylor, and you are going to give her some instructions about the long-term follow-up care she is assigned to do. This is the task. We need to understand what exactly is the task here. The receiving nurse is assigned to do long-term care. So she is not only going to do the immediate follow-up care. She is going to carry out or care the patient for a longer span of time. This is what the task is requesting from us. We are going to convert this case note to letter. Before that, we'll be going in detail what exactly the task is. The date of admission of Bethany Taylor to our hospital is on the 1st of March, 2018. And she stayed in our hospital for almost 18 days. Now, she has some relevant past medical history. That's hypertension, maybe due to fibromuscular dysplasia. But we need to understand that she has hypertension. Now, she has primary hypothyroidism. That's something which is also relevant to some extent, because some medications may interfere with both the conditions. And whenever we go ahead with the the background, the familial and social background of Miss Bethany Tailor. She is she's the daughter of Henry Tailor and Barbara Tailor, and she is not employed. Right now, she is on disability allowance for schizophrenia. So this gives you an indication that the patient is not just diagnosed with schizophrenia. So if she is eligible to get the allowance for schizophrenia, it's definite that she had schizophrenia at least 6 months or a year earlier, or else she won't be getting this allowance. So this patient is not new to schizophrenia. That's what we understand from this particular line. Now, let us go with the history of polysubstance abuse. So what you mean by polysubstance abuse? It means substance abuse in many forms. You know, substance abuse that may be drug abuse, such as alcohol, marijuana, cocaine, heroin, all these things. So poly means multiple substance abuse. And now something they have written, that is the last used cocaine 28 February 2018, very recently, just a day before the admission, she used cocaine. Now, on 1st of this March 2018, she got admitted. So it is self-admitted. Normally we say presented, but it's another word for presented, self-admitted. So not something which is relevant. So if I say Margaret presented or Margaret self-admitted, it's exactly the same. And many may think that this is something relevant. If it is relevant, this becomes relevant if you're writing to a psychiatrist, going to write to a long-term care nurse. So I think that won't be, these two things won't be that much relevant. Many of the candidates might write these two things. They may feel that these two things are very important, but this is relevant to a doctor, and this is understood. This is self-admitted means presented. If you write self-admitted, it's okay, but I'm not telling that that's, I don't feel that that's something which is very significant here. Now let's go ahead with the medical background. No, before we go with that, decompensated schizophrenia. So why, what is the reason for the admission of Miss Bethany Tailor is because decompensated schizophrenia. What is this? Decompensated schizophrenia. So the schizophrenia which was not resolved earlier, it came out. Maybe due to poor drug compliance, whether she was not taking medications properly, or it may be due to the substance abuse, increasing substance abuse. It is very evident that she used cocaine just a day before. So this may be the reason. It may be both or what? Now, medical background, non-compliant with medication. So it is both. Now, she's using the substance. She is non-compliant with the medication. So naturally, schizophrenia will be decompensated. Now, these are the complaints which was present at the time of admission. So when she was admitted to the hospital, she was complaining of hallucinations of two types. auditory and visual. Now, we are not going to see the details of these types of hallucination because we are concentrating on the care and not the condition. We are concentrating on the care of the patient, the long-term care of the patient. So if we concentrate on in detail instead of giving importance to the care, if I go with hallucination and the type of hallucination, my purpose of writing may be deviated. So I should not go in detail what type of hallucination and see what type of auditory hallucination she has. So somebody is going to telling the patient to harm herself. So visual hallucination is some shadow figures are with grinning faces. These types of hallucinations. If we go and explain all these things, it will become difficult. The word count will become more and more. So we just need to say, if you want to say hallucinations, you have to say hallucination. If you want to say delusion, you just say delusion. What type of delusion? You are going to describe delusion. So if you are going to describe auditory hallucination, visual hallucination, delusion, you're going to write a lot more sentences there. Now, again, it's written 1st March 2018, agitated, aggressive, responding to internal stimuli with thought blocking and latency. So it is there. So when she was admitted, she had hallucinations, she had delusions, she had agitation, she had aggression, she had thought block, and she had latency. So commenced antipsychotic medications, risperidone. Now, you can say that you might have these medications before, because that the patient might have been discontinued or skipped the medicines before. Right now, it may be possible. So right now, some candidates they write recommenced. I don't recommend recommenced because we don't have a proof that risperidone was going on before. So you just have to say prescribed with the antipsychotic medication, that is risperidone. Instead of commencing or recommencing, I recommend the word prescribed with. And now we have the improvements, a progress here. No hallucinations, less delusional, disorganized thinking, no thought blocking and latency, now able to minimize delusions and focus on activities of daily living. So in around 1.5 weeks, she's progressing from her conditions very clearly. Now let's go with the nursing management which you gave and the long-term nursing care home has to carry out. The nursing management which you gave and which they are expected to follow, they are expected to continue. The nursing care includes assess for objective signs of psychosis. So objective signs of psychosis means you are not going to feel. So when you just observe the activities of this person, you should not feel that this is an indication of psychosis. You should see the classical signs of psychosis. You know that you are a medical personnel. You are a medical personnel. You know the classical signs of psychosis, how it's objective signs. Objective signs is that, yes, exactly what exactly is the classical signs. If it is present, say, please observe that. So you don't feel that. So the person is acting in somewhat way. So don't feel that this is psychosis. If you have the classical signs, then you go with that. Assess. Redirect patients from delusions. If patient is having delusional thoughts, you need to monitor and immediately need to redirect the patient. So you know that the patient is non-compliant with the medications at the ensure, you have to ensure the medical compliance, medication compliance. Now help to maintain behavioral control in the sense that discipline, behavioral discipline won't be there. The patient may skip medicines. The patient may go ahead with the substance abuse. You need to maintain the behavioral control of Miss Bethany Tailor. And if you understand that the behavior is out of control, if possible, you need to provide a therapy. So if you understand the behavior is out of control, which is not manageable, you please provide therapy. Now, about the assessment. So after the hospitalization, now we are going to discharge, it's 18th of this March. Almost around 17 to 18 days she was there in the hospital. So when we assess what exactly is the present condition of Miss Bethany Tailor, is that she has good progress. No hallucination, less delusion, no delusion, no thought blocks. So she has good progress and her insight is good. Her judgment is fair. These are all the positive things what we understand from the assessment. But what we need to do is that what we need to understand is that this is a chronic mental illness. This is schizophrenia, which can decompensate if not on medication. If the medication is altered or skipped, or if she uses any substances which abuses for abuse, like alcohol or cocaine or something, then definitely this will relapse. So this condition will be reversible. So you have to understand. So assessment is that this is a very tender condition. This is a very delicate condition. Even though we can say that she has good insight, we can say that she has judgment, a fair judgment and good prognosis, we have to see the dangers, the potential risk of relapse. If she is not compliant with the medication or if she is having substance abuse. Now, if I go with the discharge plan, discharge on risperidone, 4 grams nightly by mouth. When the discharge medication. Now the same medication, 1 milligram available twice daily PRN for agitation or psychosis. If it is out of control, maximum 1 milligram you have to give twice a day, so to control the psychosis. So the drug therapy is very clearly given as instruction. When the patient is getting discharged from the hospital, you're supposed to do this. You're supposed to start this every night. So it should continue. This is a discharge medication. Now, along with the pharmacological management, we have some other nursing management which needs to continue. And this is the same thing. The nursing management, you can see here the same thing. So if you have written there, please don't write it here. If you have not written there, please write it here. Some may write it here in the conclusive paragraph. Some may be feeling comfortable in writing there as you have done it. So if you have written, you have done it and it needs to be continued, it is well and good. So if you have not written that there, you can say as an instruction here. And that is a very detailed explanation of this case note. And let's go with this answers in brief. So we don't have time here. So this is the date, the discharge date, addressee. It's Maria Dicosia, because if the name is there, we have to address Miss Dicosia. Miss Bethany Taylor, aged 35. I'm writing to refer Miss Bethany Taylor, who has been under our care for decompensated schizophrenia. So some may be comfortable in writing schizophrenia, just so I don't have any problem there. If you are writing schizophrenia, it's correctly, no problem. She requires your ongoing care and support following her discharge today. So nothing more complicated here. Miss Taylor presented to our care on 1st March 2018, yes, around 17 days before, with classic symptoms of schizophrenia. You can say classical symptoms. It's not classic symptoms, classical symptoms. Classical symptoms of schizophrenia, including delusion, hallucination, aggression, thought blocks, and latency. All these things are not mentioned. Some of these things are mentioned. So classical symptoms of schizophrenia includes hallucinations, delusions, and disorientations. So that's included there. Therefore, she was prescribed with antipsychotic drugs to which she responded positively. So, therefore, she was prescribed with antipsychotic drugs to which she responded positively in the subsequent days. Now it's okay. When she responded positively, after a week, and I think after 10 days when we assess, we can see that the progress is there. Now she was also provided with possible therapies, including redirections of delusions. Okay, now we have provided with possible therapies. Possible therapies in the sense, therapies which are possible on her. Now, what we did is that redirections of delusions and maintenance of behavioral control, which have to be continued for a longer time. So what has to be continued for a longer time? This has to be continued for a longer time. At present, now the therapies, non-pharmacological therapies, whenever possible, she was given these therapies, and this has to be continued after discharge. At present, she has fair judgment, good insight. However, decompensation is more likely in case of poor medication compliance or substance abuse. Now we have to see two things here. Right now, she has fair judgment and good insight. However, decompensation is more likely. There is a higher probability in case of poor medication compliance or substance abuse. Now let's go ahead with the background. Something is relevant here. Some past medical history and habits are there which we need to indicate to the nurse who is going to care this Taylor, that she is unemployed. It's not that much relevant, but as we are going to write the profession of the patient in most of the cases, there is no harm in writing she is unemployed. She has a history of hypertension, Yes. What is the reason for hypertension? Not mentioned. So primary hypothyroidism, it's also written. In addition, she is a non-case of cocaine and alcohol abuse. This has to be very underlined thing. So now you have to be very careful that this patient is a non-case of cocaine and alcohol abuse. So these two things has to be taken care, because this is something very serious. If you see the patient using substances like alcohol and cocaine, the patient is definitely going to a decompensated stage. Upon discharge, Ms. Taylor is recommended to continue all the ongoing treatment modalities from your facilities. From your facility, you are requested to provide all the ongoing treatment modalities. So you don't need to go ahead with from your facility. It is understood that it is there. Ms. Taylor is recommended to continue all the ongoing treatment modalities upon discharge. Where is not relevant, it is understood. Kindly start tablet risperidone 4 grams every night. And in case of any agitation or psychosis, an additional dose of oral risperidone 1 milligram can be given twice a day. So you have to continue all the ongoing treatment modalities plus the drugs, specific drug that is their risperidone 4 grams every night. And in case of any psychotic symptoms, you can add 1 milligram twice a day. So please do not hesitate to contact me if you have any further queries regarding Mrs. Taylor. Ms. Taylor, you are sincerely nurse psychiatric ward. And that is the end of the explanation there. Thank you.